Students who are preparing for NEET, for surgery, for head and neck surgery, for any examination, MRCs included. This important topic is asked frequently. Questions revolve around certain important topics, and my focus today would be an important fungal infection which we give the name as mucormycosis. So some of the students might be well aware about this disease condition, and I will be going about the most focused points in relation to this disease. Now, as far as mucormycosis is concerned, we have to remember that we can also give it the name as phycomycosis, alternative names. Now, these mucorales are an important group of fungi which are non-septate, broad and pleomorphic. In addition to this, these fungi happen to be saprophytic and abundant in nature. They are present in multiple and diverse products, say starting from the soil. The fruits can be contaminated, the vegetables can be contaminated, the bread, normal bread which we take, that can be contaminated. So one has to be very pretty sure and careful about this infection. Now, what predisposes to mucormycosis? Mucormycosis is in fact a rare infection, rare in occurrence, but not rare in exams. It is common in exams and rare in the reality. So this is rather a rare disease. And who are the people who are frequently predisposed to mucormycosis? You have to remember this thing, because a clinical scenario sometimes gives you a hint in the form of history of the disease. So I will be enumerating certain conditions. Number 1, patients with diabetes mellitus. Not only diabetes mellitus, especially the patients of diabetes mellitus who have got uncontrolled diabetes, say especially the patients of diabetic ketoacidosis. In addition, patients with hematological malignancies, immunocompromised patients, organ transplant patients, patients having inherited defects of macrophage and neutrophil deficiencies or dysfunction, especially patients on deferoxamine therapy. This group of patients is more predisposed to develop this fungal infection, and this fungal infection is important because it is fatal and aggressive. I will be coming to the points why fatal and why aggressive. You have to remember one important point, that it is an angio-invasive infection. And what we mean by angio-invasive, the blood vessels are particularly affected by this group of fungi. In addition, you have to remember that these fungi invade the blood vessels, cause the thrombosis of the vessels, cause the necrosis as well of the surrounding tissues, and invade not only blood vessels, the lymphatics as well as the nerves, and cause local destruction of the tissues around them. That is very, very important. Angio-invasion of the structures is important. And what the angio-invasion causes? It causes occlusion and subsequent infarction of the organ, or the surrounding tissues. So what is present? Characteristically necrotic tissue. All the surrounding tissue becomes necrotic. And the presence of necrotic tissue is very lethal. That is why it behaves as highly aggressive. Now, the patient, depending upon the location, this mucormycosis is a common ENT problem. The nose, the paranasal sinuses would be involved, the orbit can be involved, the surrounding brain can be involved in a very short period of time because of necrosis, edema of the neighboring tissues. We can have the pulmonary as well as the GIT forms of this disease. The pulmonary form would present in the form of a severe and rapidly progressing pneumonia, and the GI disease would present in the form of diarrhea, nausea, vomiting, high fever, and necrosis of the parts of GI tract. Very, very important. Now, how do we diagnose this infection? We can diagnose it by biopsy. Biopsy will be showing large areas of necrosis. The MRI is also a diagnostic modality of choice, and it would detect the same areas of necrosis and tissue destruction. Black necrotic tissues are characteristic pathological hallmark of mucormycosis. Now, you have to remember that it is an emergency. Mucormycosis happens to be rather a surgical emergency. You have to start treatment ASAP. And what are the important treatment modalities? Amphotericin is an effective antifungal, and intravenous amphotericin should be given in severe cases. Then you have to do excision of the local surgery, excision and debridement of the local surrounding tissue which has gone necrosed. It can cause widespread gangrenous involvement, so you have to debride the surrounding tissue. Surgical debridement with antifungals and other antibiotics are to be managed as quickly as possible. This is what we had to remember about mucormycosis. And believe me, you get this topic asked frequently in your exams. So I think that what I have mentioned in few minutes of mine, you will be concentrating on these points specifically. Remember all the points I have mentioned, and I wish that you fare well in your exams. Have a good one.